Good morning, everyone. Thank you so much for joining us. We are going to give everybody a moment or two to log on, and we'll begin shortly. Good morning, everybody. Thank you so much for joining us today for Virtual Insights on Kidney Transplantation. Our topic today is Transplant Success Stories, a real-life experience from recipients. Today's session will be recorded and sent to all those who registered. We encourage you to submit your questions in the Q&A section. It is now my pleasure to turn things over to Judith.
Good morning, everyone. We have a little bit of a special morning scheduled here. I'd like to introduce Kerry. I'll tell you a little bit more about her, but she's kindly agreed to share her experiences regarding kidney transplant with us this morning. So we have a guest speaker. Before I introduce Kerry, just a couple of things. 2023 here at Cornell, we had a remarkable year. We did a total of 286 transplants, so that's 286 people either avoiding or getting off dialysis. That's remarkable. We are top 10 in the nation for living donor transplant. We also performed our 6,000th transplant, and it was our 60th year anniversary. So a busy year here at Cornell. We didn't really have a big celebration. It was something that was on the cards, but sort of got away with us a little bit. But it's nice to go back and have a look at some of these old photographs about the beginning of transplant. And it's kind of sad that I actually recognize some of these faces from many years ago. That was on the left, and then on the right, these are our today people. People that are on our team right now, and patients and donors alike. So 60 years here at Cornell of transplant. So much of with transplant is storytelling. You know, each and every person that comes through the program have got their own story, and it's unique. Believe me, I've been in transplant now since '97. I have just, I mean, I should have written a book because it really, you know, it would honor all the people that I've worked with during that time. There's threads of hope connect each and every one. It's certainly a stressful time. People describe it roller coaster. There's a lot of decisions to make about how, when, what. But you know, success stories and listening to them, if you are on the waiting list right now, could certainly make your wait a little easier to know that you're not on your own and there is light at the end of the tunnel. So we all know that transplant certainly impacts your quality of life. And you know, these are just some of the pictures of people that have been through in the not too recent past. We've got a 10-year anniversary, we've got a 4-year anniversary, and we've got a more recent transplant. So today, here's Kerry. Kerry is 30 years old, and she lives out on Long Island, lucky her, with her husband, Kenny. And she received a living donor kidney transplant, and this was from her childhood friend, who we can see in the photograph with Kerry. And her name is Annie. Kerry is going to be celebrating her 4th year anniversary in June. Congratulations, Kerry. And she works in advertising at Amazon. So it's a little bit, and here just some more family photos, just so that we feel we're really getting to know Kerry. In her free time, she loves cycling classes with her husband. She likes to be on the beach at Jersey Shore. Get that sunblock out, Kerry. And spending time with family and friends. Also loves to bake desserts, especially chocolate chip cookies. And if you guys, any of you have any questions for Kerry, please feel free to type them in the chat box. And, you know, we will get to as many of them as we can. So I don't know how you're still so slim, Kerry, when you're a dessert cook. That's not fair. It's just totally unfair. So
That's what the cycling helps with.
there you go.
To balance
Hopefully a
the
lot of
kidneys.
that. So, first of all, we were going to talk about some of the causes of kidney disease. In your instance, Kerry, can you share a little bit about, the symptoms that you may or may not have had and how it affected your life?
Yes, definitely. So I have polycystic kidney disease. So some of the symptoms that I felt, especially leading up to transplant, were fatigue and some side and back pain due to the size of some of the cysts on my kidneys. And, I helped manage that by working with the team, my medical team of doctors and nurses, to keep open lines of communication with how I'm feeling and how I can manage those symptoms, taking Tylenol and the amount of fluid intake I would need to make sure that I can be my healthiest self leading into transplant and help manage my symptoms so that I could continue to live the fullest life that I could ahead of my transplant.
Excellent. So the good news with polycystic, of course, is that it does not recur in your new kidney. So that's always a point I make when people come through with polycystic, that diabetes unfortunately will recur in the new transplant, but you're getting a new kidney and the disease is not going to come back. So as we can see, some of these slides, if everyone has joined us in the past, it may be a little bit repetitive, but just sort of as a reminder, the causes of kidney disease. Of course, polycystic kidney disease is one of the big ones as far as inherited disease go, but by far the majority is the diabetes and hypertension combined. That comes to about 73% or so of diagnosis for end-stage renal disease. The others, there are congenital abnormalities, the autoimmune type, like the lupus, kidney stones, kidney cancers, urinary obstructions, including enlarged prostate, and repeated kidney infections. They're just sort of, one of the most common sort of causes. So as far as the emotional impact of kidney disease, when you got this news, Kerry, how did you process this? And, knowing at such a young age that you may, require a transplant at some point.
Yes, so I received my kidney transplant when I was 26, which certainly was a little younger than I had expected. I think that news comes with many emotions, but I was so lucky to have family and friends as a support system that I leaned on emotionally to, talk through different decisions I was making, and then of course leaning on my doctors and nurses to help me make those decisions too. I think when you can balance those emotions that you're feeling with informed and educated decisions with your doctors and nurses, it makes it a little bit less intimidating, and knowing that you're making the right decision by, talking through all options and making sure you're getting the best care helps with that, handling some of those emotions.
Oh, good. And what advice do you think you would give to someone that, this is a new diagnosis to them? You've got the 2020 vision, so to speak, as being through this. What would you tell somebody?
Yes, definitely. I think just stay hopeful. Everything will work out, and as you're working with your doctors and nurses, knowing that staying as positive and hopeful as you can, that mental positivity will help your physical health and make sure that you're staying as healthy as possible going into transplant as you're ready to receive that amazing gift. And not being afraid to open up and share with whoever you feel comfortable with, whether it's close family or friends. Kind of opening up will help people understand what you're going through more with some of those symptoms, maybe why you're a little bit more tired or why you're feeling a certain way. And then they can help, empathize and help you in any way too. And I think having that support system from your medical team and then your family and friends will put you in the right position.
That's a good answer. I do remember saying to patients, when I used to take care of people pre-transplant, that, you know, their family members may be the ones to tell them you're in a really foul mood, you know, and you may not even realize it, but the uremia, you know, can really change your personality, and yeah, and it's so true. Not an easy thing to face, but again, light at the end of the tunnel, and you know, you're certainly living proof of that. So, you know, living with kidney disease, whether it's chronic kidney disease, whether you're on a waiting list, whether you're on dialysis, whether you're waiting for a transplant, it's a roller coaster ride. I think, you know, a lot of people have used that term, but there are ways that you can help yourself. And we do offer a support group here at Cornell. We meet the first Wednesday of each, the second Wednesday of each month. And we meet from 10 to 11, and we've got a very, it's a small group, but I have to say, we see the same people again and again, and it's something that I would recommend. I think people have been able to take something home when they've joined us, because all we're doing is we've got people that are post-transplant as well as pre, so it's a really nice mix, and people can really take something home from it. You know, as well as our support group, there's all kinds of organizations that are available to us, the National Kidney Foundation, et cetera, et cetera. They have this organization called NKF Peers, and it's a mentoring program. And again, it's been, you know, sort of having a one-on-one when you're struggling with something, that there is actually somebody to talk to. Okay. Whoops. So living donor transplant. So can you tell us a little bit about how you found your donor? You know, that whole sort of story behind this.
Yes. So when I heard that I needed a kidney transplant, I first reached out to, you know, immediate family and close friends who weren't able to be a donor for various reasons. And after that, my amazing family began to share my story and post on social media, specifically Facebook, that I was looking for a kidney donor. And I'm so thankful for my family and friends to post when I didn't necessarily feel that comfortable. And so I'm so thankful for them for doing that. And my amazing friend, Annie, who is in the picture with me here, saw my family's post and signed up to test to be donated, and then kind of the rest was history. And so, yeah, I think sharing your story on social media, you know, you never know who will see it, and you never know who will respond. And sometimes it's really hard as the person needing a transplant to be the one to post yourself. So I would encourage people to lean on family and friends who are willing to post and share to really get that message out there.
Yeah, that's sort of, I think, the hardest, a real sort of a stumbling block for a lot of people here is about how you actually approach someone and ask. You know, it's as the National Kidney Foundation say, the big give, big ask, big give. You know, how do you do that? I mean, it's, you know, what worked for you?
Yes, definitely. I think leaning on my family to, you know, being open throughout the process leading up to my transplant. My family and close friends knew sort of like emotionally and physically all of the things I was feeling. And I think that helped them want to share my story too. And then, yeah, once they were able to share, it was so amazing and so inspiring how many people also shared my posts or, you know, commented and things like that. So I think just being as open as you can be during this difficult time, and encouraging you know, your family and friends to help you, and then the rest will work itself out.
Wow. So that's the advice that you would give to patients that are currently looking for a donor?
Definitely be open as you can, and be hopeful, and just, you know, continue to share your story. And I think relying on family and friends too, and you know, them knowing your story will help with finding that special donor.
Well, thanks for sharing that. It's, you know, we realize it's a very tough part of your life, but again, you know, it's a fairy tale, and here we go. We've got a happy ending.
Oh, definitely. And I mean, I'm so thankful for Annie, because how amazing is she that she saw this post and, responded to it and donated her kidney to me. Just such a special person. And so, I try to, when I see people on Facebook posting different things or social media, continuing to share other people's message, because, again, you never know who's going to see it.
No, it's so true, so true. So just to reiterate a little bit, I'm going to leave you we've got a few slides just to review, Kerry, but don't go anywhere, please. I'm coming back to you. So, I'd like to discuss sort of transplant afterwards with you. But the group that are on, this is really to act as a reminder that the living donor transplant is really the best option for anyone that's looking to get a transplant. They function better, more quickly, more efficiently, and tend to last about twice as long as kidney from a deceased donor. And obviously, I think the advantages to having a living donor are pretty clear, but it's no waiting time. You can basically schedule the surgery, if everything falls into place. And if possible, preempt the need for dialysis altogether. So, it's certainly the treatment of choice. We would choose transplant over dialysis, but we would choose living donor transplant over deceased donor in an ideal world for everyone. My mouse is misbehaving. There we go. So finding a living donor, and again, to Kerry, if you've got, jump in at any moment. If you've got any comment about any of these things that, we are not transplant recipients, so it would certainly, jump in any time. So I think, step one, learn about living kidney donation. Education is power. You need to be able to talk about your disease and also, give the options clearly and concisely. You've got to be confident and share facts about living donation to family and friends and potential donors. And I think Kerry did, sort of relate this. You've got to be open and comfortable doing so. But having the facts, without that, it's a non-starter. Write your story. Share what it's like to live with kidney disease. The chances are people have no idea what dialysis entails or what living donation is really an option. So it's an opportunity for you to be very honest about your feelings and about how your disease actually impacts you. For any of you that have not visited a dialysis center, it can be a very, very depressing place to be. I say that, but it's also a family. People have been there for years and years. Transplant is not for everyone, and you do just sort of get your little clicks at the dialysis. Once you've got your story, then share it. You just never know. As in Kerry's case, never know who may read this and actually be motivated to help you out. Designate a kidney champion. I think this is really important. Most of us, I think, struggle with asking for help. We're very quick to offer, but it's not quite as easy to ask for someone to do something for you, especially donate a body part. So it's a lot easier if there is someone in your family or your friend circle that can be your spokesperson. So, that's certainly a good way to go. And then just keep sharing your story. Keep it up, keep going, keep repeating it. Consistency is key. I will say that people that are persistent are, it pays off in the end. It may take a little while to get there, but it will pay off for you. Sharing your stories is the way to get the word out. But remember, your story is unique and it's special, and make it that way. What is different about your situation maybe than for most other people? It's certainly a journey, but it is deeply personal. And I think the more that you're able to share, we have something called microsites that we'll talk about in a little bit. But the more you can make it unique and very personal to you, it may be hard to do, but the more you do that, the more attention your little webpage would get, certainly for a microsite. But it takes bravery. It's not easy. We are very personal people, and You don't necessarily want all your laundry out in public, but you know, if you want a donor, then this is what we need to do. So some tips. What is your life currently like, and how having a kidney transplant would impact your life? Share what efforts you've made to find a donor so far, if that's the case. Also, if applicable, why your family and friends aren't able to donate. I think, you know, that's sometimes, you know, if you're able to put that, it just sort of clears the way and against is that open and honesty that shares through. And sharing pictures is the best way to go. Again, a little anecdote. I remember when a friend of mine was looking to adopt a baby, and she said the mom that was actually giving the child over to her said the reason she chose her as the mom for her child was because there was a dog in the picture. And she said it looked like such a happy, complete family. And those things matter. It's nice to do that.
Definitely. And I can just add that I know when my mom was one of my kidney champions, and she had originally been getting tested to donate for me and one was unable to donate. And she added that into her personal description when sharing information and sharing my site for donation. And I think that helps you know, people understand that your close family and friends are trying to help in every way they can, and they've already tried. And I think even adding that anecdote from my mom, from her personal anecdote, just helps as well, and shows that you know, in the donation process, they are so protective of the donors and making sure that you know, you're the perfect match in any way. And so I do think that's helpful as well.
That's good. That's good to share. Thank you. So these are the microsites that I said that, you know, we would get to. And this is just an example about Shira's story. And, you know, again, Eliza really is, unfortunately, she wasn't able to join us today, but it's good because she's on a great vacation. But, you know, she's really become quite an expert on how to build these things. And from what I'm told, it's not a difficult thing to do. But we certainly, you know, do get responses from this, and it's just another thing, another layer that you can lay on to try to find a donor. So asking family and friends to consider living donation and getting tested was one of the most challenging things I have ever done. I'm the type of person who, if I need something, I do it myself. How many of us does that describe, right? So this time I worked up the courage to ask for help. It was amazing how my young children, ages 6 and 14 at the time, wanted to be my donors. I created my microsite and shared it on social media pages, asking or talking about my story to others just became second nature. So you can see Shira over here, and continued. To the patients out there waiting, please don't give up. A week before I got the call, I was defeated, and I had just battled 2 episodes of peritonitis. Just when I was ready to throw in the towel, I received that life-saving call, the journey that may seem long and hopeless, but don't lose faith. Continue sharing your story on all your social media platforms, and when you least expect it, the phone call will come. It's always usually at the worst possible moment too. It's so, you know, ironic how this starts. But there you go. You can see Shira. I believe this is her waiting to go into surgery, the day of her surgery. So nervous but very excited, I'm sure. So Shira continued here. I've been on the list for 4 years, but on June 22nd, 2022, I was notified that a person saw my microsite and decided to donate on my behalf, giving me a voucher, which is similar to an IOU. So for those of you that don't know, if your donor is not compatible, we are part of a donor exchange. So they donate to the system, and the recipient then has a voucher that they can cash in when a suitable donor becomes available for them. So you can see the artwork here from her kids. I received a phone call on June 2nd, 2023, that 20 days from that date, I was going to receive my kidney. Precisely a year later on, June 22nd, 2023, I got my transplant. I have an incredible connection with the person who donated on my behalf in 2022. I am in constant contact with their family, who are true gems. I am forever grateful to have them in my life. Pictured as a thank you note that Shira's kids drew for her donor. Again, it's all so personal. This is very much Shira's story, but I think there's little snippets of it that we can all sort of relate to. Never give up. One thing about this experience, so this is Marquise. One thing about this entire experience I've learned, having lupus and waiting for a kidney transplant, patience and have hope. Hope is a thing we hold on to that propels us forward when all seems lost and confusing. It drives us to achieve our dreams and goals. It is their light. It's their light at the end of the tunnel. And Marquise was transplanted January 20th, 2021. Becoming a living donor, a kidney donor. So on the left here, we've got Dr. Joe Del Pizzo, who we have been fortunate enough to have at our program here since I think it was 2020. 2000, the year it came, or 1999, right around there. And he has brought a lot of expertise to our donor surgery here. He really is a master at what he does. And then on the right-hand side here, we've got a donor. Again, this is, I know this is pre-op because that's, you know, I recognize those windows. And this is the donor, and it's saying, doing good feels great. I wish everyone could feel the joy and pride I've experienced throughout this journey. I never thought I would be able to help save someone's life. This only had a minimal impact on me as the donor, but it was life-changing for the recipient. And you talk, and I would say 99.9% of the donors that donate feel this way. They feel like you've almost done them a favor to let them donate, because it really has. It's been life-altering for them too, to be able to do something, you know, of this nature. So, becoming a living donor. If anyone you know or love wants to learn more about living donation and have them speak to someone, they can certainly, our team is large enough, and you know, we're sort of experts in our own different rights within different groups here. Don't rule a donor out. A lot of people think things like high blood pressure is an automatic rule out for a donor. It's not. So have somebody complete the questionnaire. And if there is a concern, believe you me, we are quick to rule people out. I think sometimes the donors themselves get very upset with us, but if there is if there is a risk, that is what we're going to do. We're not going to put somebody through this knowingly. You know, the team wouldn't be able to sleep at night if that were the case. So every donor is under a microscope before we let them proceed. So people considering donation must undergo a vigorous evaluation to assess their suitability to be a donor. The evaluation is designed to protect the donor. Donors can register by cornell.doctorscreen.org, and all donors are automatically connected to a mentor. And that is either choice. You don't have to have a mentor, but I think it's nice that someone that's, again, been through this process is available, so that if they've got questions as they go on, they can do that. So did you know that kidney donors tend to have a higher quality of life score after donation than the general population? It may be released to an increase in the donor's self-esteem and an increased sense of well-being. It's, again, I could sit here all day and talk the stories about the people, the incredible people that I've met that have been donors, and just how selfless people can actually be. And the Donor Connect is the mentor program through the National Kidney Registry. So living with a transplant, here we go. So what would you say is the most challenging part of being a transplant recipient, a kidney transplant recipient, Kerry?
Yes, I think there are so many amazing benefits of having your transplant, but it does come with a few challenges. For me, I found learning about and starting to take many medications post-transplant was the biggest challenge for me. I wasn't on many medications prior to my transplant, so I was a little bit unfamiliar um, with not only the process of making sure, insurance and different things are lined up for medications, but also different side effects and things like that with managing your medications. And my advice would be to be patient with your body as you're taking new medications and different side effects. Things take time to sort of balance out, and making sure that you're giving your body the grace to sort of accept these new medications and become your new normal. And then also, but making sure that you're an advocate for yourself. These are really important medications that we need to take multiple times a day. So making sure that you have, enough to not run out, and making sure that you're on top of renewing your medications and working with your doctors and nurses to get the right prescriptions and get the right tests to make sure that you have all of the correct levels. It can be a little bit daunting at first, but once you get into a rhythm and work with your doctors and advocate for yourself, it becomes part of your routine, and becomes less of a challenge and more of a routine.
Mhm. Yeah, I think you really echo what most people tell us, especially, I guess it does become part of your life. And then it's almost, you don't even really think very much about it. But initially, it's got to be pretty daunting. I've seen the size of the pill containers, and it's sort of go, wow, what am I carrying? A suitcase? It's a little bit of work at the beginning, that's for sure. So, I think, again, we're just going to echo pretty much what Kerry just told us, that living with a transplant, it's a lifelong process. You just get more and more used to it. Medications do have to be taken. We're working very hard. Instead of having multiple doses in a day, they are trying to make medicine so that it is every 24 hours. And there's been certainly some progress in the last few years. We're not quite there yet with all of them, but these medications, without them, we lose the kidney. It's that simple. So you've got to take them religiously to keep this organ as long as you possibly can. And then there are other medications that are not just the anti-rejection medicines, but things that there are antifungals, antivirals, antibiotics. Over those first few months, they do start to drop off. But again, when you leave the hospital, you've got a lot of pills. You rattle. You feel like a walking pharmacy. There are frequent visits, after you have been discharged. And again, it's certainly concentrated more closely to the transplant, but the further you get out from the surgery, the less frequent your visits need to be. How often are you seeing a physician right now, Kerry?
Yes, right now I go about every 3 months, and I've been pretty consistent on my anti-rejection medications, which is such a blessing. But just because I am consistent, I'm also consistent with my appointments to ensure that I'm still feeling correct and that those are the correct doses.
You're the perfect patient. You are the perfect patient. So yeah, those visits are essential. We've got to make sure things can happen and change in your life, and then the dosages can change, and we do try to wean people down if possible. So it's very, very important that we keep a close contact with you. Knowing the signs of the organ rejection and watching for them, are crucial, because if you have one of these symptoms, you've got to sort of weed out this can wait till tomorrow versus, I've got a real problem. I need to get this taken care of now. Your body will be the best person to inform us if you're not feeling well, or if something important like urine outputs change dramatically. So, you know, if your body really does tell you. A symptom is a symptom that something is probably not right and needs attention.
Definitely. And I would say don't hesitate to reach out to your doctors and nurses. They're so willing to help you with any questions, even if it's a phone call, like, you know, your urine output might be different or you have a certain pain, and they'll help you measure, you know, how that should be dealt with. And I think also continuing on the schedule of whether it's eventually every 3 months, and of course, right after transplant, it's, you know, almost every other day. It helps with that peace of mind too, because you have this amazing gift and you want to protect it at all costs. And just trust and listen to your body, and don't be afraid to reach out, because you know, you'll be able to tell when something might need extra attention.
That's a good point. And yeah, I mean, and in this day and age too, you don't even need to be on a phone call. You know, everyone should have an email address to certainly their PA. You know, the PAs follow our patients here the closest, and you know, they certainly know a warning sign and would contact the physician if needed. But here, living with transplant freedom. This is what this is why we do it. And you can see here, Hector. So our transplant recipient, Hector Sanchez, had his kidney transplant in December of 2018, and he's atop Machu Picchu in the Andes Mountains in Peru. And this picture was taken in 2022. His quote, Hector's quote: "Some people visit Machu Picchu seeking its magical powers or even a miracle, but I didn't need to wish for more than I already had. Everything, my life, my world, my family, my very self felt like enough." What a wonderful quote. I mean, it's just pulls at your heartstrings. And again, there's something about mountaineering. Maybe it's, I don't know, something in the medication or something here. But anyway, so 1 year after the transplant, my therapy pup, Biscuit, Mom, Dad, and I are at the panoramic summit of Giant Mountain and Adirondack High Peak. We celebrated a renewed life with this one peak in mind. Invigorated by the view, the burning in our legs, and the blisters on our feet, we unanimously say, why stop here? Since then, we've climbed 19 peaks and counting. I've discovered that hiking up peak is very closely related to life and a chronic condition. There are a variety of ups and downs and unexpected slaps in the face, but every step you make along the way counts. The step size does not matter, only that you take them. It's been 5 years since my dad graciously donated his kidney to me, and I've been living this new life. And this is Dana Satterley, transplanted in 2018, kidney transplant recipient. So I mean, we could go on forever. It really pulls at my heart. I mean, I've been doing this for nearly 30 years, and I've got tears in my eyes. You know, you can't. It's amazing. So, what do you think is and this is for you, Kerry, what do you think is the most rewarding part about receiving a transplant? That's a hard question, I know.
I was going to say, I think that the list is endless, but I think just having the gift of health and being able to return back to a sense of normalcy in your life, and also being able to be there for the big moments in life too. After my transplant, I was able to get married, which is so exciting, and I'm just so thankful for Annie and for the relationship that we have. It's so special to have this amazing person in your life, and I'm so thankful for that relationship too. It's one of the best things that's come out of my transplant. And yeah, just being there for big events with my family and friends, and then appreciating the little things. I think you have a different sense of perspective post transplant, and I'm very thankful for that.
So I've actually got a question here from the panel. How difficult was the first 6-month recovery period?
Yeah, definitely. I think 6 months, by 6 months, you're feeling fabulous. I think the first 3 months can be a little bit more challenging. Certainly right after transplant, when you're released from the hospital, you're going back to your doctors every other day for testing and medication changes, while also still feeling, some of the effects of the surgery, maybe like some fatigue and some appetite changes from the surgery. So I think balancing, having to change medications and making sure you're on top of some of those changes while also not feeling your best is a challenge. But I would say if you have some family and friends that are a strong support system, they're able to help you, keep track of different changes with medications and things like that. And makes that process a little bit easier. But really after, the first few weeks, you have this new working kidney, so your energy levels really do pop up so much higher than pre-transplant, which everybody tells you, but I think once you feel it, you're surprised by it as well, even though you do often get that feedback. And so I think just being patient with yourself and letting that new kidney get comfortable, but then you really start to feel well. And I was already able to walk so much more. They encourage you to walk and get moving as quickly as possible. And I was able to walk so much more post-transplant than I was pre.
That's amazing. I mean, it really is amazing when you think about it. You have surgery, but you're so much healthier afterwards. It's one
Oh,
of the few things, yeah, that's amazing. Thank you. So, the key to maintaining a successful transplant is obviously taking these anti-rejection medications. It's without it, you don't have a transplant. It's simple as that. And you need to take them, as long as that kidney is working for you. Staying in close communication with your post-transplant team, again, is key. It's a two-way street. There's got to be open communication both ways. If there's any questions, no question is a dumb question. I cannot tell you how many times I've said that to people, but it's absolutely true. You may be on many different medicines that include anti-rejection, antibiotics, and others, and it's very individualized depending on you and your disease. Get involved and stay connected, and then inspire others by sharing your transplant journey. The first thing I used to say when I go down and visit people after a transplant is, please, please, please go back to thank your dialysis staff. Nobody wants to go back to the dialysis center once they feel they've left, but please do so. The staff there are incredible. They do a very, very difficult job, and they are just thrilled to bits when somebody is actually released from the clutches. So my mouse is really misbehaving. So for those of you at Cornell, you'll probably recognize a few of these people on the screen. Right dead center in the middle is Dr. Kapoor, our fearless leader, and surrounded by all his team. We're one of the largest volume transplant centers in New York, and the largest living donor kidney transplant center in New York. We're also ranked amongst the top kidney paired exchange programs. We were actually the founding center for the National Kidney Registry, and we've been working closely with them very, very closely ever since. Our motto here is maximize the opportunity for transplant. We do that by easing the access to the center, hopefully improved outcomes, and safely transplanting our patients. This is just a graphic depiction of where transplant has been at this center. The red bar being deceased donor, the orange being living donor, and then the yellow is both transplants combined, and you can see the 286 mark in 2023 was our best year ever. As far as resources go, we do have a lot of educational resources available to our patients. We've got a website to cornelltransplant.org. We have a living donor center in there, which gives information about donor criteria, their evaluation, and surgery, and also asks frequently asked questions. We also had I did a seminar, and this was in conjunction with the National Kidney Foundation. It was called The Big Ask, the Big Gift, very aptly, and it, you know, there are interviews with somebody, an altruistic donor actually, and also with a recipient who took 2 or 3 years to be able to find a donor, and what she did and what she went through. And so that's also part of the our website. We've got an events page just to say what's up and coming, our webinars, and you know, I'll give you the slide in the next picture. Here you go. Kerry, again, you're center of focus right now. Kerry, we've got you on quite a few pictures. But the Big Ask, Big Give, I think, is a very valuable tool to help people, you know, that are looking for a donor and need some guidance. And so here, these are the webinars that are up and coming. In April, we're doing Living Donor, again, stories of generosity and renewal. On the 28th, 29th, we're looking at the different things within paired kidney exchange and how this has opened up just a plethora of options for living donors, donating years in advance or whatever it is you may want to do. The National Kidney Registry has just really opened up, you know, the floodgates for what we can do now. In June is our medications, and our pharmacist will be talking to you about the different medications. In July, challenges and triumphs, and that's just navigating life after transplant. 28th, 29th, we'll have Michael, our nutritionist, speak about you know, the foods that you shouldn't eat. September, mental health and well-being, you know, the help available to support the recipient. In October 29th and 30th, pediatrics. November 19th and 20th, advances in transplant and kidney transplant specifically. So we've got a busy calendar coming up. You know, there are patient resources available for all different types of things. Again, the support groups. You know, I personally was somebody that used to poo-poo support groups a little bit until I actually attended a support group, and wow, you get the right one. It's, you know, and again, we've got a very, very loyal following to the point where people are sending us emails to say, oh, you know, something came up at the last minute and I can't attend. That's fine. It's not mandatory attendance, but they really want to be part of it. So I'm really pleased with how that's worked for us. And again, you know, there's TRIO is the Transplant Recipient International Organization. There are chapters all out. There's one on Long Island, and we have the one in Manhattan. But you can see Rockland County. I mean, they're everywhere. And you know, this is all groups too. So you get to meet heart recipients and intestine recipients and liver recipients. So it's they do education things, and it's quite something. It's a great group. As previously mentioned, this is our support group, and we are going to be sending this presentation out. And so if it's something you'd like to do, you can just scan the QR code, and that will take you to the link to register. Connecting with us, Facebook, Twitter, formerly known as X, whatever, you know, all the different social medias. Eliza's very active on all of them, and you know, you please take the time to go in and take a look. On this slide is my own telephone number and email. There is a wonderful, I think it's a wonderful site for people that are looking to multi-list. You put in your blood group and that's where the shortest waiting time is, and it scans everything through the nation and gives you the information. I think it's a wonderful resource. The scientific registry is just where data is kept about success rates, waiting times, that type of thing. OPTN, or the Organ Procurement and Transplant Network, there is a patient services wetline. hotline. This is, again, it's if there's questions that you may feel that, we as a centre are not answering, certainly you can contact OPTN. And then organ transplant process. Again, this is, a government website, but there is good information on all of these. And then UNOS, the United Network for Organ Sharing, they organize and run transplant regarding the list and that type of thing. So these are all good resources for, detailed questions. So has anyone else got questions for Kerry while she's here? And Kerry, all in all, is there anything that you'd like to say to someone that's waiting for a kidney transplant?
Yeah, I would say just stay positive and hopeful. I know we talked about how it can be both emotional and physically challenging ahead of the transplant, but just knowing that you'll feel so much better post-transplant. As I was waiting for my transplant, I remember people asking, if I was nervous, and I honestly just felt so excited to feel better and to be on the other side of it. So I would encourage you to, try to feel that way too, with balancing all of the other, emotions that come with it. I was so lucky to have watched, my dad also is a kidney transplant recipient. And so I had watched him have his transplant and living a healthy life post-transplant. And I think that's so helpful, going into your own surgery. And so, hopefully I can be that for other patients, a sign of, a healthy life post-transplant, and that it's an exciting and, amazing opportunity to feel better and live a full life.
That's, again, it's inspirational. I think for you can never give that wisdom. It's going through something is the only way to be able to talk to the people that are going through it right now. I could speak forevermore, but it just doesn't carry the weight of when. And thank you so much for taking time out of your morning, Kerry. I can't thank you enough for doing this. And we will be calling on you again, I know, to hit you up for something else for the program. It's been an absolute pleasure. Thank you so much.
I don't. So thankful for you too, and all the work that your team does. I saw Dr. Kapoor on that slide. He was my surgeon, and I'm so thankful for the whole team. And of course, my donor, Annie. Thank you to her as well.
Again, thank you, and goodbye, everyone. And hopefully you'll be able to meet with us for the upcoming webinars. So take care and good luck, everyone. Take it. Bye-bye. Bye-bye.